And calcium scoring is a CAT scan that detects the amount of calcium that's in the coronary arteries. And it generates a score that's directly proportional to your risk. The greater the score, the greater your risk, and the lower your score, the better.
So it's a non-invasive. You're not going into the arteries itself. You're doing this, again, through a scan.
Completely non-invasive, no IVs, no dye, nothing like that.
When you're looking at individuals who may be candidates for this, what are you looking for, and when do you let a person know, I think we need to schedule one of these?
It's kind of complex. It's a very good question. The guidelines don't all agree, but the American Heart Association, for example, in 2010 came out with the guidelines and suggested that moderate risk individuals are decent candidates for screening.
Okay.
I still find it useful in very low or very high risk patients, but that's a very individualized basis, so you should definitely see your doctor and figure out if it's a test that you should consider.
Men, women, more susceptible than one or the other?
Well, men definitely are more susceptible to cardiovascular disease, but women catch up very quickly after the age of 50 or so, so everybody's should consider something like this.
And really quickly, because we're trying to wrap us up here, when you have a test like this, how can this, in the long run, be something that really is something that saves your life?
Well, where I have kind of stumbled into where it's been very valuable for me is when I'm trying to decide to use a statin. Kind of a difficult decision for a lot of patients, and where it actually winds up making a life impact is getting somebody on board with taking a statin. If you can show them, hey, you've got this narrowing here, people get on board.
All right, and then I always tag this out with, if you have any questions, you always contact your physician. Don't talk to us in the newsroom. Kim, over to you.